Shivaram. Dr. Ramasamy, I'd like to ask about the EECP treatment. What is Vaso-Meditech EECP therapy?
EECP is called Enhanced External Counter pulsation.
Yes, doctor.
It is a non-invasive treatment for patient with angina
Yes, doctor.
or patient with heart failure or poor heart function. The treatment is a completely non-invasive, it does not involve any surgical procedure, and it is a daycare procedure. So the ideology of this, or the concept behind this treatment is, it improves the blood circulation of the heart muscle without patient undergoing any intervention procedures.
Okay.
So the increased blood flow, once it is achieved, it can able to naturally bypass an obstructed vessel. So the heart muscle will get more blood supply and the patient can able to avoid undergoing a bypass surgery or an angioplasty.
Fine, doctor. Then who are the candidates for this EECP therapy?
Yes, any patient who have chest pain, who have poor exercise tolerance. See, any time when a patient had a cardiac patient, they are put on some medical management. Many times the medical management itself is sufficient, so the patient don't need any other intervention procedure. But in some group of patients, even with medical management, they get chest pain with a minimal exertion. They cannot do the routine activity,
Okay.
so they go to the office, they get chest pain.
Okay.
So these type of patient would be an eligible candidate for this EECP treatment. Or patient who are elderly, who cannot do the routine exercise, can take this EECP treatment. Or patient with cardiac risk factor, like they are hypertensive, they have hypercholesteremia, or their diabetic is uncontrolled, they have a strong family history of heart disease. So these patients can also undergo EECP. Another is by angiogram, once the disease is well established,
Okay.
many times these patients are offered invasive procedures like bypass surgery or angioplasty. So if the patients are not willing to undergo this invasive procedure, I think EECP would be the best option.
Fine, doctor.
And lastly, there are group of patients who would have gone for bypass and angioplasty,
Okay.
but still they have symptoms, and the repeat angio may show that the graft which they put in a bypass surgery is closed,
Yes.
or the stent they have put by the interventional cardiologist has closed.
Yes.
So these group of patients are also will benefit from EECP.
Doctor, can you tell about the collateral circulation?
Yes, collateral circulation is one of the important component of your heart, and actually I would call it the plan B mechanism which is given by the God. So once your main vessels are blocked, many people think when the main vessel is blocked, I'm going to get a heart attack. But many times they won't. The reason is because of the collateral circulation. It is a circulation which is present, but it is dormant. So when there is an ischemia or when there is a blockage, to protect the heart naturally, this collateral will form, and this collateral can naturally take the blood flow against the blocked artery. But unfortunately, the formation of the collateral is a very, very slow process. Many times the collaterals, by the time it forms, the patient might end up getting a heart attack, or already his heart function would be compromised. So to promote the collateral, EECP is an option. So once EECP is given, this dormant collateral become active, and the blood flow to the heart muscle can be restored, and then the patient can become asymptomatic.
Okay, doctor. With the proper indications, we are selecting the patient for EECP therapy. So how long will you do this therapy?
Yes, now the EECP treatment, the patient needs some kind of a long-time commitment. So the treatment is 1 hour a day. It is given as an outpatient basis, a daycare procedure, so the patient don't have to get hospitalized. So 1 hour a day for 6 days a week for 6 weeks. So 35 days the patient has to come. In certain patients, based upon the coronary anatomy and the physician's decision, they can do 2 sessions a day so that they can able to finish it in 3 weeks.
Okay, fine, doctor. So you are actually finally you are choosing a patient, and the patient, how should he prepare himself for this treatment?
Yes. When we decided the patient to undergo EECP, we give some simple instruction. So the patient should be should not take anything orally, a solid or liquid food, at least 1.5 hours to 2 hours. This restriction of food is done so that during the procedure they are not uncomfortable because of the food in the stomach. And second, if they are on any cardiac medication, they would be requested to continue the same medication. But your EECP physician or expert would look at your heart medication and they may make some changes, or some of the medication they may ask you not to take before treatment and they can take only after the treatment. And also before you start the treatment, you are asked to void the bladder so that you don't have to get up very often during the procedure. Because during EECP, the blood flow is increased to the kidney also, so they might have to use the restroom very often. Otherwise, the patient can do all the routine activities same, and they don't have to have any restriction on the routine activities.
So when you start the treatment for the patient what does he feel about the treatment?
Yes, usually the patient come to you for EECP treatment because they are symptomatic. The symptomatic means there are certain symptoms. Number one is chest pain. Usually the chest pain comes when the patient exerts themselves, when they walk. And sometimes if the disease is very severe, this chest pain comes even when they are in the resting condition. And second is another cardiac symptom, shortness of breath. They become breathless even with a small activity, and they cannot lie down in the night without getting up, or they usually sleep on a sitting posture. And there is an extreme tiredness. Even minor activity they become tired, or even taking a little food they feel like a full stomach, or dry cough when lying down position. These are actually the cardiac symptoms. So when these symptoms, when this patient started EECP treatment, usually they see the response within 10 to 15 days. So the patient may be able to walk more distance, or they may be able to change their medication. Some of their medication or for chest pain can be reduced. So by 15-20 sessions they see the improvement. By the completion of the treatment of 35 days, the patients are usually back to the routine. So that is the amount of improvement the patient can obtain during the 35 days of EECP.
So you said what are the benefits they'll get during the time of treatment. So by 10 days of treatment, how many days they'll feel the...
Usually the response depends upon how severe the coronary artery is.
Okay.
But I would say around 70 to 80% of the patient, they start seeing the improvement by the 15th session.
Okay.
And that is why they say, doctor, I'm feeling better and I would like to continue the treatment.
This will consider as benefits of the therapy, this what you said now?
Yes, I think the benefit, as I said, it is what the patient wants to achieve. They want to improve the quality of life, walk more distance, they want to reduce the nitrate intake, and they are very particular, the quality of life can be restored.
So these are the benefits of the Vaso-Meditech therapy.
This is absolute benefit what the patient derive from undergoing the Vaso-Meditech EECP.
So what should I do after completion of the therapy?
Well, this is a very good question, because any treatment, when you complete, there are certain things you have to follow. And for cardiac disease, whether you go for a bypass or an angioplasty or EECP, some of the recommendations are done. So during EECP, actually your collateral circulation significantly improved. So the blood flow to your heart muscle is improved and you are asymptomatic. So once the blood flow is significantly improved, then you have to retain this collateral. So how to retain this collateral? Even after completion of the treatment, you should do regular walk every day. We advocate at least 30 to 35 minutes of regular walking, slow pace, every day, at least 5 days to 6 days a week. And other things are risk factor. You should make sure your cholesterol is well controlled, you make sure your diabetes is well controlled, you make sure your blood pressure is well controlled, and also you should improve your lifestyle. So food, you have to change your food habits, and all these things you have to follow after the completion of the treatment. If you do that all correctly, you don't have to repeat the treatment anymore. I think you will be fit enough to carry on your regular work.
Fine, doctor. Good, doctor. Actually, what is if you are selecting the patient? Okay, fine. What is the age limit for the patient?
Well, I mean, EECP is absolutely a non-invasive treatment which does not have any adverse effect or any clinical complication to the procedure, and any complication is very, very less.
Fine.
So age is not a limiting factor for EECP. We are given as young as around 25 to 30 years and as old as around 95 years old. So I wouldn't have anything about the age. Any patient with any age can able to take this treatment.
So in cardiac treatment, there's an invasive treatment and a non-invasive treatment. So in what way this is better than the invasive treatment?
Well, this is a very good question, because most of the patients who select invasive procedure as an option think in I would thinking about chronic stable angina. If you are a stable patient with occasional symptoms, limiting your exercise tolerance, and you have the symptom for long enough, and then you have an angiogram, and the cardiothoracic surgeon or cardiologist said you have a multivessel disease, and most of the time the physician chooses the interventional procedures assuming themselves that taking this interventional procedure will protect the future occurrence of cardiac events like heart attack, like a stroke, or a hospitalization for chest pain, or non-fatal MI, which we call as STEMI, and all this other stuff. But as a fact, and all the clinical literatures and data shows, no, all these things cannot be avoided by going for an interventional procedure. what you achieve by going for intervention procedure is just a quality of life. So I would say EECP would significantly improve your quality of life, similar to what a bypass surgery and angioplasty can achieve. And in fact, EECP is not only specific to your coronary artery, because all other treatments are actually specific to your coronary artery. You put a graft in the coronary artery, you put a stent in the coronary artery. But EECP, by increasing the blood flow across your body, you naturally improve your vascular health. Because a vascular health is a predictor of the future occurrence of your heart attack and events. And I think having a EECP, you would have a protective effect because it improves your vascular health, while your bypass surgery and angioplasty may not give that benefit to you.
Right. So with the proper indication, you are just subjecting the patient for the treatment. So after completion the 35 days of treatment, so the benefits, how long it will sustain? How long he will get the benefits?
Yes. Usually, as you know, during the treatment there is a significant improvement of blood flow to the heart muscle. So the simple question is, when I stop my treatment after 35 days, would my symptom recur again? But there are a lot of studies to show the benefit of this EECP treatment you get during the 35 days of procedure will last even up to 5 to 7 years. So the treatment benefit would last longer than it is actually applied.
Okay. So now we talk about the treatment procedures and the benefits. What are the risks do you expect in this treatment?
Okay. So this is the most important thing with the EECP, because its risk is very less. Because doing an EECP and increasing the blood flow, I would equate to a type of an aggressive exercise.
Right.
So whatever the risk involved in an exercise is it for EECP. So if you are an anginal patient, the risk that you might have a heart attack or any cardiac event during the procedure is very less. I would say less than 1%. But sometimes now, EECP is also given to patients with severe LV dysfunction. In that, their heart function is very bad, that it is working only 10 to 15% of the original working condition, which is around 60 to 65%. Even in this group of patients, when any other procedure is done, it is high risk. But EECP, it is very safe. But as a physician and a therapist, if they are properly trained, you may be able to reduce the risk of what we call pulmonary edema. Otherwise, if they are not properly trained, there is a chance of around 5% the patient might go for a pulmonary edema because of accumulation of fluid in the lungs.
Right. Doctor, you said 1 hour in a day for 35 hours.
Yes.
So if the patient misses a session,
Yes.
so what do you...
Yes, I mean, I would say EECP as a stimulus. The stimulus has to be very high, which is 1 hour, and it will be as continuous as possible. But if you have 1 or 2 days, you are not able to come, it doesn't matter. You can come up and finish the session later. But what we don't want the patient to do is irregular, like coming for 3 days and 4 days they are not coming, and again coming for 4 days and 2 to 3 days they are not missing the session. These type of sessions will break the stimulus and they might not get the benefit. So 1 or 2 is okay, but don't do the treatment in a regular or a irregular fashion.
Fine. Doctor, can EECP treatment dislodge the heart block?
Yes, I mean, as well as a clinical research and safety concern, there are more than 50,000 patients would have been completed the treatment. There is no record to show anybody would have ruptured or the block would have been in the coronary arteries dislodged to cause the heart attack. Because as I said earlier, EECP is a kind of an exercise. So how bad is an exercise is going to worsen your condition, your regular walking. So basically, I would not say EECP has any effect on dislodging the clot, and there is no evidence to show that it really does.
Fine.
So I don't think there is anything to worry about. The patient has to worry that it may dislodge or causes heart attack during the procedure.
Okay, fine. Doctor, actually, if the patient is having a pacemaker, can you subject the patient for this EECP therapy?
Yes, I think pacemaker is definitely not a contraindication, and patient with pacemaker can definitely take EECP treatment.
That this therapy can worsen the BP, blood pressure?
No, actually it is the contrary. Many times, because this EECP treatment increases the blood flow, many people think that it may also increase the blood pressure. In fact, EECP is not only increasing the blood flow, which is the inflation of the cuff. The cuff in the lower limb deflates so that it significantly dilates the vessel. So it has been shown in many patients with hypertension, the treatment actually reduces the blood pressure after the 35 days of treatment.
Okay.
So it is a contrary. EECP would reduce your blood pressure rather than an idea of its increase of blood pressure.
Right. Doctor, one important question. If the patient is already subjected for the invasive procedure, can the same patient subject for this EECP therapy?
Yes, as I was always say, coronary artery disease cannot be a cure. It is not a disease which can be cured, and no treatment can actually cure the disease. So once you have a bypass surgery and angioplasty, it's not going to be the end of the treatment. It is only a palliative or a temporary relief provided by the graft or the stent they put in.
Okay.
Naturally, the stent and graft eventually may close down, or the stent and graft may be still normal, patent, but the patient might develop a disease in another normal part of the coronary artery.
Right.
So in any case, the symptom can reoccur, and in that case, EECP would be the only option for them, because doing again a recurrent bypass surgery or angioplasty would carry a higher risk. So these patients can definitely take EECP as a treatment option.
Fine, doctor. What about the diabetic patient?
Yes, I mean diabetics, recently many studies in EECP show in patients with diabetic, EECP tend to reduce their blood sugar level. So it has a protective effect. So patients who are undergoing EECP who are diabetic usually tend to have a better control over the glucose level and better control over the glycemic index.
Okay. Doctor, you said you put the cuff in the lower limbs. So what about the patient having the varicose vein?
Patient with varicose vein, it is actually a cosmetic problem. They have the dilated vessel and it engorged vein. It's usually difficult to see. It's a cosmetic reason, but usually it won't cause any problem to the patient. So during EECP, this varicose vein is not a contraindication, but actually it improves the circulation of the venous return, so the varicose vein will reduce in size.
Okay.
But it's only a temporary. When you stop the treatment, the varicose vein can come back. But only time we cannot provide EECP treatment is when this varicose vein gets infected, phlebitis.
Okay.
So that is a condition we may not be able to provide EECP. Okay. Otherwise, EECP can be safely provided to this patient with varicose vein.
Fine, doctor. For doctor, if the patient has got irregular heartbeats, that means ectopics or atrial fibrillation or something like that, what about this therapy?
Yes, there are studies to show in patients with atrial fibrillation, EECP can be safely administered, and the benefit this patient derived from EECP is similar to the patient who have normal sinus rhythm. But sometimes if they have a very irregular QRS complex or frequent QR, I mean we call as a ventricular rate is very high, you may administer certain drugs which may reduce his heart rate, and then we can apply EECP.
Okay.
So these type of patient can still undergo EECP without any complication.
It's almost like a varicose vein question, doctor. It's a patient has got the bad circulation in the lower limbs.
Yes.
What do you do for that patient?
Yes. Many times patients who present with cardiovascular disease, coronary artery obstruction, they are diabetic and they are more prone for disease across the entire vascular system. So these patients tend to have peripheral vascular disease. Okay. So if they are again smoker, many times what happens, they have what we call as a claudication pain. This patient, if they walk a short distance, they have a excruciating pain in their calf region, which is called a claudication pain. When this pain occurs, we know these patients have peripheral vascular disease. So EECP, since it increases the blood circulation to the entire vascular system, many times this circulation would improve in the leg also,
right.
And these patients would benefit from EECP because now they can able to walk more distance.
Right.
So, but because of the vessel, the coronary circulation, the patient might require more session to achieve the improvement in coronary circulation. But doctor, it is not a contraindication.
Fine. Doctor, so far we talked about the cardiac patients. So any other disease will benefit from this therapy?
Well, in certain conditions, we have seen in patients with diabetes, it has shown to significantly reduce the blood sugar level. So many patients with diabetes has approached for EECP, and also patients with hypertension and dyslipidemia and patient who was smoker and who has strong family history, EECP can administer as a primary treatment because it's just stimulate and exercise. And also sometimes in patients with renal failure or a high creatinine level, because of the low cardiac output symptom, EECP significantly improves the cardiac output. And also EECP has been now experimented in patients with stroke.
Yes, doctor.
So in a stroke, there is a significant reduction in the blood flow.
Okay.
So the stenting is not as much possible as we put it in the coronary artery.
Fine.
So EECP can significantly increase the blood flow to the cerebral circulation, so they may be able to reverse the stroke condition also.
Fine.
So these condition also EECP is beneficial. And many vascular condition now EECP is looking as a viable treatment option. But still trials are on.
Fine, doctor. So it is advisable to take the EECP therapy more than once?
As I clearly said before, coronary artery disease, no treatment is a one-stop solution, because a patient with coronary artery disease, the disease reappear again and again. Even when you stent or graft or form new vessel, again the new vessel will get disease, or the old vessel which you grafted and stented will close up. So it is a continuous problem. It is not we have cured the disease, we have given temporary relief by improving the blood flow. So the disease itself remains with them. The disease is actually the patient's tendency to form obstruction in the coronary artery. So obviously patient, if they become recurrent symptomatic, EECP can be again repeated. And since it's a simple non-invasive treatment, it can be reapplied without looking at any cardiovascular, without any looking at any complications.
Fine, doctor, fine. So if the patient is undergoing the EECP therapy, so when the patient can start the exercise like?
Yes, usually when we start the EECP, many patients come for EECP because they may not able to do the regular exercise. They cannot even walk for 5 to 10 minutes without shortness of breath or discomfort or tiredness. But after they undergo a 15 session, around 15 session of EECP, we usually ask them to go for a regular exercise. This is a time they may able to walk more distance than before, and the patient is also being confident that they can able to walk. So around 15 to 20 session, depending upon the LV dysfunction and depending upon the severity of coronary artery disease, we advise them exercise.
Fine, doctor. Doctor, so far you talk about this Vaso-Meditech EECP therapy. Is it FDA approved?
Yes, the treatment provided by Vaso-Meditech EECP centers are all using a FDA approved system. The FDA approval is very essential because FDA is an organization to look at the equipment safety, and also they give recommendation for which condition the treatment can be used, and the system which they use are validated by science, and it is evidence based. So whichever system we use only the system which is being approved by US FDA. So Vaso-Meditech EECP systems are all approved by US FDA.
So it has got papers also?
Yes, it has records to show when it was FDA approved, and all the clinical evidence to show whatever we claim we make are absolutely true, and it is based on evidence.
So in what are the places this is available?
Right now, what our Vaso-Meditech EECP centers, we initiated as a small program with one center in Rayapeta. Now we have grown up to 22 centers, and it is spread across 3 states, Tamil Nadu, Kerala and Maharashtra, and also we are planning to put in Assam and Delhi.
Good.
So this is a program we have created to improve the patient's cardiac condition non-invasively.
Fine.
So we attribute our center as a purely non-invasive treatment to treat your heart disease, which is evidence-based with qualified physician and well-trained therapists.
Fine, doctor. Is it insurance approved?
Yes, in many conditions, the insurance does approve EECP if certain eligible criteria is there. And it is also if a cardiothoracic surgeon or cardiologist or a EECP consult can write a recommendation that this treatment is required at this juncture of this disease, I think insurance company do approve EECP.
I think, doctor, it will be really helpful for the patients, cardiac patients. Thanks for your better information, and hope. Thank you. Thank you, doctor.
It's an absolute pleasure,
Thank
doctor.
you.
Thank you very much.
Thank you.